Should I get a scan? So I get asked quite a lot in the clinic, should I get a scan? And the truth is, like, let's consider, why do you want a scan? Yes, okay, we might have a clear understanding what's going on, but you haven't considered what's the end goal. Why do you want a scan? What do you want to achieve? Because you can go get a scan and the options can tend to be conservative care, so manual hands-on therapy. Sometimes they'll offer you, for example, injections for pain relief and so forth, or surgery. And the truth is, we want to avoid surgery as much as possible because there's risks associated with that. And oftentimes the outcome isn't any better with surgery compared to hands-on therapy. So do you really need a scan? Probably not. And obviously during the assessment, we'll be able to guide you on that, whether it's necessary or not. But oftentimes we've got a really good idea of what's going on, and if we're concerned and you think actually you could possibly need a scan, we can put you forward for a scan, but while you're waiting for that scan, do some hands-on treatment and try some treatment to get you moving forward. And you probably find that you actually get improvement in your pain and function before you even get a scan, and actually that scan isn't necessary. You can go to your doctors and ask for a scan. Sometimes they'll give you a scan, sometimes they won't, but you'll have to wait for that scan anyway. So let's try some conservative care like hands-on therapy, because the likelihood is one of those options after you've had the scan is to go through the NHS and have physio, or go privately and have some hands-on therapy anyway. So you might as well get started now, and then if you need a scan, at least that's in the pipework. Or the other option then is obviously it's not bad enough for surgery, or it is bad enough for surgery, and then you go for surgery, but again you'd have to wait to see a consultant. There's a long waiting time. So let's trial some hands-on therapy and see if you get any improvements before taking that big risk and going for the surgery, where that should be a last resort, because obviously when you have surgery you can have scar tissue. Oftentimes you're still left with some residual pain because oftentimes there's not one thing going on. So the thing people ask most of the time for a scan on is if they got any disc issues, so any disc herniations, any pinched nerves, for example. The outlook for having surgery and hands-on therapy, the end goal is very similar. So the outcomes, the results in the long term are very similar, but you don't have to go through obviously the surgery and the risk of having surgery. We have a good idea of what's going on anyway in treatment, so a scan isn't always necessary unless there's something going on that we think we should have a look at, but we'll be able to guide you on that. So before you consider having a scan, let's get a full assessment, see what's actually going on, and we can help guide you. But also consider your outcome, what you want to achieve by having a scan. Yes, you can get a bit more peace of mind, or actually this is exactly what's going on, but oftentimes your course of care or your options are going to be the same if you didn't have a scan. The other problem is with scans, they don't tell you the whole picture. So yes, they might show up, for example, you might have a bulging disc on a scan. But actually, when you come and see us, you've got a whole host of other issues going on that if you just went straight for surgery and had that disc sorted, there's other issues you still be in pain because there's other issues going on that you haven't addressed first. So let's address those, and if things don't settle down, then we can obviously look at other options.